Hello there, you're welcome to Heather Living with yours sincerely, Oloije Oikokai, the first in the year 2025, and we say Happy New Year to each and every one of you. All right, today on Healthy Living, making sure you stay healthy. Remember, health is wealth. Now, today we're talking about dental care for the elderly, challenges and solution. With me is Dr. Sakwe Ibinove Calvin. He is a dental surgeon. Good afternoon.
Good afternoon, ma'am.
And Happy New Year to you.
Same to you.
Okay, now quickly, we're talking about the elderly. Elderly. I want to emphasize that word, elderly. Now, before we get into talking about dental care and how it pertains to the elderly in our society, now, do you feel that the elderly, like in the developed countries, they call them the seniors,
okay,
the seniors, they call them the seniors, and they are well taken care of in the Western world. Now, when it comes to Africa, Nigeria, do you feel that they are well taken care of?
Well, if we are comparing, in comparison with what they do in the Western world, of course, they are not well taken care of. That's just the truth, all right? Because the government need to step in, because most of those cares, they actually having are subsidized by the government, all right? They are under insurance, okay? There are insurance programs that covers them, so the government is actually aware of this, and they are the one in help that help them.
Okay. All right, now we're talking about dental care for the elderly, challenges and possible solutions. Now, quickly, dental care. What is dental care?
Well, it's simple, all right? It's actually a practice that we do to keep our, keep our oral environment. Talk about the gum, the teeth, and the tongue, all right? The practices we do to keep them in
check.
All right, in check. That's what dental care is all about, okay? Practices like as simple as toothbrushing, flossing in between the teeth, and, going for checkups, routine checkups in dental clinic. So this is what dental care is all about.
Okay. All right, so now let's go to the elderly. Dental care for the elderly. Now, how do we go about this? What are the relevance of dental care to the elderly?
Okay, this is very, very important for them because at this age, there are a lot of illnesses or a lot of diseases, and the dental aspect of the human body is not left out, okay? So it is important they always visit the dental clinic for checks and for basic dental procedures like scaling and polishing that they are supposed to be doing every 6 months. That's twice in a year, all right, to keep their oral head or the oral cavity clean, right, so for them to have good oral hygiene. So, and when they do this, go for checks, go for dental checks up. If there is any, disease, oral disease that is starting or that is on its onset, it can be, discovered. And at this point, care for these diseases is actually, how will I put it? It's, okay, let me put it this way, that treating them at this stage,
it's important.
yes, it's very important, and you are going to achieve a very good result at this stage. Or rather, what we use the medical prognosis for them at this stage. When you discover these diseases early, prognosis is quite very good for them. So we advise the elderly, strongly advise them to always present themselves before the dental clinic for routine checks. Now, they don't need to be having any pain or having any disease before they go, because some oral diseases will not manifest with pain on its onset or at the early stage? No.
Okay.
All right? And there are some medical conditions that at their early stage will manifest in the mouth. Because I've been using the word oral cavity.
Yes.
So let me use the word mouth so the people will
So
understand
everyone
very
will
well.
understand, yeah.
So there are some systemic diseases. When I mean systemic, other diseases in the body that are, their primary site is actually not in the mouth. All right? They could be, in fact, as common as diabetes. All right? It can manifest in the mouth.
Okay.
That is even for someone that is undiagnosed, that the person is not even aware that I have diabetes. In the mouth, there are some manifestations that the dentist can see. Okay, this person is diabetic or is having diabetes, and with that, they can be referred to the specialist who should take care of them. So this is a very important aspect of, of health for the elderly, because you cannot neglect or separate the dental health from health generally.
Okay.
Do you understand? So
Yeah.
it's the human body, it's full body. All right. Yeah. So what affects one can affect the other. So it's very important for the elderly people to always present to the dental clinic early or to go for routine checks. I think that's a better statement to use. Go for routine checks, frequently, like twice in a year.
Okay. So what are these most common dental issues that come along with the elderly?
Okay. We did not even define the age. Okay, fine. Well, we know elderly people,
Elderly.
people are old, all right?
Yes.
Okay. Usually, sometimes we
From
say
60.
from age 60 thereabouts, all right? Now, as the body is aging, there are some form of changes in the body, all
That
right?
occurs.
Yes, that occurs in the body. Now, in the mouth is not different, all right? As you're aging, the teeth
Becomes weaker.
Or
Yeah,
use the
because
word, becomes brittle.
yeah, so some persons will say as you age in life, you tend to start behaving like a child.
Yeah. So the teeth becomes weaker and they become prone to fracture, breakage.
Yeah.
Any little force from mastication start breaking them. So you see a lot of elderly people or elderly individuals present with what we call attrition. Attrition is simply the wearing of tooth substance.
Okay,
of
so
teeth,
a
all
little
right?
breakage.
Yeah, the breakage, start seeing them around the tooth, or what we even call another type of tooth wear lesion, abrasion, like a cut around the surfaces of the teeth, between the gum and between the edge of the gum and the teeth. All right, you start seeing some holes, like hole depression there. This is actually what causes cervical abrasion. Then, or they start having periodontal pockets, all right, spaces in between the teeth now, all right, and this can, lead to further dental issues. Okay, so at this age, they present with this, and the elderly are also prone to caries, dental caries. Why? Because, like I said just now, the teeth at this age, they are becoming weak.
Okay.
So they can start having cavity, tooth decay on the teeth. All right, these are some of the challenges they face. Then fine, some of them can have come down with some chronic diseases like diabetes, some neurological diseases, or even some musculoskeletal diseases like myasthenia gravis and the rest of them. They can come down with arthritis and the rest at this age. All right, rheumatoid arthritis. These are diseases that affect the joints and the bone. All right, at this age. So when they come down with this, the bone of the jaw can be affected too, especially with arthritis. And when this happens, the patient, especially for arthritis, they may not be able to, care for their mouth very well. And for some musculoskeletal diseases, all right, like myasthenia gravis, they may not be able to care for their mouth very well. All right, these are some of the challenges the elderly will face as they are getting older. All right, so we always, like I said, advise the elderly patients, or rather the elderly people, let me not use the word patient, to always visit. I will always emphasize, in fact, in this program, I always emphasize that, to always visit the dental clinic. All right, because it's when you come that we can tell what is wrong and what should be done.
Okay, okay. All right, so you say from the age of 60, it's,
Upward.
yes, upwards, it's very, very important that the elderly visit the dental clinic. Now, someone out there might be wondering, is there a particular toothbrush that the elderly needs to make use of? Because we know as a child or the younger generation, you tell them, oh, there's a particular toothbrush they need to use for their tooth and all of that. So is there a particular toothbrush that the elderly out there needs to go out for in order for them to be able to take good care of their teeth?
Okay, well, generally for children, all right, that are not yet up to the age of, we use the word pediatrics, age of 15, 16, okay? Sometimes we tell them to use the soft Bristol toothbrush.
Yes, yes.
All right. Okay, for example, this is a toothbrush, all right? This is actually what they call the Bristol.
Okay, so it's
All right?
soft.
Yes. So for children, we advise soft. While for adults, okay, up to the elderly age, we
Yes.
advise the medium.
Hard.
No, not really hard. The
Okay.
medium. We call it medium.
Okay.
Medium Bristol. All right. There are hard toothbrushes. All right. All right. Or rather, hard Bristol toothbrush. There are medium. We advise medium, and there's a reason for that. All right. Now, when you use the hard Bristol toothbrush, it can cause the tooth care lesions I talked about just now, like abrasion and cervical abrasion, and can even lead to attrition as it were. All right. Why? Because they are hard, and it's just like you're using your metal file to cut an iron. All right. And before you know, you start creating a cut on it. So if you keep on using the hard Bristol toothbrush, and you're pressing against the gum every now and then, you're scrubbing, you start creating a cut on the tooth. So that's why we don't advise.
But you find some persons say, the hard one is the one that will brush the teeth properly. But this one is too soft. I don't want the soft one.
No, it's not like that.
So
It's
so
not-
you
we advise
mean
not really soft, medium.
okay, medium.
That's
Okay,
the word,
so
yes.
for those above
Well,
what age?
from like age 14 thereabouts.
Okay,
Once you start
okay.
doing that permanently sometimes, it's
Okay.
okay. Even start
So do you
using your-
feel the medium, like you said?
it's good enough?
Okay, so it's good enough.
It's good enough.
Okay.
Yes, it's good enough. And if you go to the supermarket or most of you see it, the descriptions are there.
Okay.
Yes, they label them, they write them on the toothbrush. You see
Yeah.
soft, sometimes hard, you see some
Yes,
medium.
yeah.
So they are there. So we advise the medium.
Okay,
All
medium.
right, yes.
All right.
It's good. That's just what you should use.
Okay. All right, in case you just joined us, this is Healthy Living on your darling station with yours sincerely, Oluije Oikohai. And we're looking at dental care, relating it to the elderly in our society. Now, we know a lot of persons have their fathers, their mothers living with them, and they don't even care about how they go about brushing their teeth or even taking them to the dentist. Anyway, when we come back after the short break, we'll be talking more on that. Don't go nowhere. All right, thank you so much for rejoining us on Healthy Living, and we're looking at dental care for the elderly, possible solutions if there are any. All right, now when we went on a short break, I was actually talking to Dr. Sakwe. The reason why we find the elderly, our grandfathers, our grandmothers, our uncles, our auntie who are aged, why do we find them, their tooth easily falling off?
Okay. When you the word falling off is like you're talking about mango falling from the tree. All right,
Okay.
mango falling from the tree.
Yeah.
Well, yes, we have cases with some elderly patients where you start they start having mobile teeth.
Okay, mobile.
Teeth that are shaking.
Okay.
And before you know, they start falling off, like you said. Yes, there are reasons. In fact, there are a lot of reasons for this. Okay. Yes, I think while we were talking before, I made mention of chronic diseases. Now, okay, well, we know some of these chronic diseases is associated with the elderly. Most of them, the aged group, most of them have this. You know, they have the come down with what do you call them? Yes, ailment, these chronic diseases. Okay. Now, for people with diabetes, you know, they start having weakened bone, the bone that holds the teeth.
Okay.
All right. They start having destruction of that bone, and before you know, the bone that is supposed to be holding the teeth is weakened, and before you know, the tooth is mobile. All right. We used to see a lot of them. All right, because that's one of the complications, actually, oral manifestation, oral complication of diabetes mellitus. Okay, so they start having weakened bone, and the bone is destroyed, and before you know, the teeth will be mobile, and the next thing you go is to extract the tooth on their own. The tooth can just exfoliate and go off. Yeah. Yes. Okay. Then when they come, I also said it just now that most of them, they come down with you know, cavity, dental caries, and sometimes they start doing self-medications or self-treatment, so to say. And they visit pharmacy. In fact, people, a lot of minds start telling them, don't do this, don't remove your teeth, if you do this, that. In fact, what they just know, or what they think is, when you come to the dental clinic, the next thing they will do for you is just put one plier on your tooth and yank off the tooth. That's what they think. No, that's not it. There are a lot of treatments that can be done. Because, you know, I said it just now, when you present early, then the outcome of your treatment will be good. There will be good prognosis. All right, but most of these patients, they don't also present early, all right, to dental clinic. So, in fact, I'm saying it here today, if the person out there is a diabetic patient, you should, in fact, that's one of the reasons why you should even visit the dental clinic. You should visit routinely, at least twice a year. It's very important for our, you know, for the elderly one, for our seniors, who are, most of them that are with, you know, chronic diseases. They should present to the dental. They should go for routine checks always. All right, that's my advice.
All right. So how can, you know, family members help to, you know, assist the elderly, our fathers, our mother, grandfathers, and all of them in, you know, getting good oral hygiene?
Okay. In this part of the world, oral health awareness is quite poor, but very, very, very poor. And I'll give kudos to the independent television and radio for, you know, for what they are doing, for the job they are doing in trying to, you know, create public awareness for oral, you know, health. All right. You know, I will suggest that. I'm sorry. What was the question again?
Yeah. How can family members help to?
Fine. All right. Now,
you know, help the elderly ones to get oral hygiene.
Okay. Good. So, because the elderly are not aware of, you know, what oral health care is, so they really don't take good care of their oral. They don't even know what to do. You know, then it was, or in the olden days, it was just the use of toothpick. In fact, there are people at this present age who still, that's what they use. I mean, even in town, yeah, they use chewing stick.
Chewing stick.
Yeah, that's what I want to say, chewing stick. It's not bad, all right? It's not that it's bad. Yes, it's one way you can clean your teeth, all right? But you see, for our elderly, when you tell them sometimes, okay, come to them, they are always scared because of what they've had from other people, all right? Maybe bad experience.
So how can family members now help them?
Yes, because the reason why I was trying
in correcting this abnormality.
Yes. Now, what they should do for the caregiver for the elderly, should always advise them, should talk to them. Especially when you're telling them and they say, no, I don't want to visit. You should always let them know that it's not a painful thing. It's just for check. It will benefit you. All right? Then, for those with those chronic diseases, for instance, like myasthenia gravis or Parkinson's disease, that cannot brush. Yes, the caregiver should help them to brush. All right, they should help them to brush. But in fact, this is even the simplest way you can, you know, avoid gum diseases, dental caries, that's tooth in the cavity on the tooth now, and some basic dental diseases. All right, they should help them to brush. In fact, there are electronic brushes that you can buy. In fact, they don't need to use the hand, it vibrates. They just put it in and it vibrates and it helps to
brush teeth. They should get them this if it's possible. If the means is actually there, they should get them, and they should encourage them to always come to dental clinic for checks.
Okay.
And once they come for checks, generally what we do is we do scaling and polishing for them. With that simple procedure alone, that is cleaning, general cleaning of the mouth, they will be good to go. Then if there are other, we check. If there are other, diseases, we can let them know. In fact, at this age, most of the times, for a worst one, they can come down with oral cancers. All right? Yes, we see a lot of them, a lot of elderlies coming down with oral cancers. All right? But people, they don't even know. It could just be a little swelling, and they think it's ordinary. It's not ordinary.
So when we talk about oral cancer, is it as a result of not taking proper care of the tooth, or just as a result of some certain ailments that has not actually posed itself?
Yes, that's just it, all right? Okay. And something is this, and there are cancers that are known to the mouth, so we call them oral cancers, all right? Okay. They are known to the mouth. Yes, there are other cancers, okay, for what we know, cancer can spread. True. All right, yes, maybe it's even cancer in another part of the body and it has migrated or it has spread to the oral cavity, yes. Okay. So,
all right, so now before we go, is there a particular way that our elderlies, they should actually brush their teeth? You know, it's up and down.
Okay.
Up and down. So is there a particular way for them to, take good care of their teeth?
Well, we have the molder here and the toothbrush. Okay. Generally, it's the same for everyone, whether for children, for adults.
Now we know that once they are going to that age from 60 upwards, like you said, their teeth become weaker. Okay. So is there a softer way to go about it?
Well, usually what we advise is we advise the scrub and the flick. All right, hair, the flick pattern, and generally you just scrub gently and you flick. All right, well, I'll just demonstrate here a little. All right, usually when you want to brush, you open your mouth. Okay. This way, all right, and your toothpaste is on your toothbrush. Then you apply with the help of the toothbrush. You just apply gently around the surfaces.
All so there should be an application first.
Yes, of your toothpaste now. Okay. Around them. Then for the upper teeth, the top teeth now, we advise you just scrub gently, all right, and you flick down from the gum down, like you are brushing away from the gum, all right, like that, just all the way down, all right. Then you go in. There's a part here, so these are also surfaces. Some people, they don't brush this part, so you just go in there too. You scrub and you scrub. Yes, and you flick out. Then you flick here out like that. Okay. All right. Then you come down. All right. You also scrub. Then brush away from the gum. Now it's coming up. Yeah. From up it was coming down because you're brushing away from the gum. Yeah. So also you brush away from the gum up like that, like that too, like that. Okay. Then you brush the chewing surface here, then you brush your tongue. It's as simple as that.
All right, thank you so much, Dr. Osakwe, for making sure you explained and tutored us on dental care on the elderly, and of course teaching us again on how to go about brushing our teeth every morning we wake up. All right, it has been an exciting time. Now, what I will have to say to everyone, watching us right now, the elderly, this is the time they need you most. They need you to take care of them. They need you to do, show them love, show them that you care about them. For those persons that can't actually do things for themselves, you just need to look at what is actually happening in the Western country, where you find caregivers taking care of these persons like as if they are their own. Now, this is your mom, this is your dad. You need to take good care.
At least if the government cannot come in now, at least the little way you can help them out, just to
take good care of them.
In fact, you don't need to bring it. Well, fine. If you can afford it, fine.
Yes.
Well, if you cannot, try to move them to the clinic where they can be taken care of.
Yes. Please don't abandon them. They need you most. All right. I'll be seeing you again next week for another exciting time on Healthy Living. Dr. Osakwe, thank you so much, and God bless you. Till then, to have yourself a blessed day. Bye for now.